I'm going to cover everything you should know before getting a vertical clitoral hood piercing. Coming up next on Consultations by a Piercer, episode number 49. For those who are new here, welcome to the channel. Welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Before we get into this, I want to express that I'm going to be talking about a genitalia piercing. If it is not acceptable for you to be watching this because of age or location, or you're just easily offended by talking about such things, or maybe you plain don't want to learn about them, which is fine, I would suggest not watching and find another video. We have plenty of other ones that cover a whole bunch of different subjects that have nothing to do with any of this. Also, if you're looking for anything that's going to be titillating or sexually exciting, you're going to be out of luck because this is purely educational, mainly directed towards those considering the piercing or want to learn more or possibly their partners. With that all out of the way, let's describe what it is. A clitoral hood piercing is located through that flap of tissue that lays over the clitoris. Vertical is done straight up and down with a curved barbell. It goes through a very thin piece of tissue. This one you definitely have you have to have an anatomy for it. Some people don't, but some people do. The idea behind it is that it stimulates the clitoris because it's in constant contact. So, average healing time in this is 6 to 8 weeks, but I suggest treating it like a healing piercing for a minimum of 3 months, which would involve cleaning twice daily using a sterile saline solution. Personally, I like Neomed's Piercing Aftercare. Comes in a high pressurized steel can. It's sterile. It comes out in a fine mist. But if you can't find that, here's the things you want to look for. Number 1, it's in a metal can and it's a pressurized can. Number 2, it says sterile on that packaging. Number 3, when you turn it over, it should say under ingredients, water and sodium chloride, nothing else. If it says anything else, that's not what you want. Now, if the delivery is a fine mist, just mist the area, let it stay in contact for 5 minutes, pat dry. If it comes out like a squirt gun or under a lot of pressure, you're probably going to be better off to do a compress. Take a sterile piece of gauze sponge or a clean paper towel, saturate it, lay it against the area for roughly about 5 minutes, pat dry. That you only do either of those twice daily. The other thing I suggest doing is the end of your shower, stick your pelvis out and let the water flow over the area for roughly about 30 seconds. What we're doing with these two things is we are removing the discharge that's going to harden and collect and deposit on the jewelry off and on throughout the healing period. We want this off for a couple different reasons. The first one being is that when the jewelry shifts or moves, it can be very agitating, which can lead to problems. It can also be very uncomfortable. The other reason is you need to make room for additional discharge. So if you come across a situation where it doesn't seem like it wants to come off or there's an obsessive amount of discharge, I really suggest going to see your piercer, have them take a look at it, have them clean it. Don't go to the medicine cabinet and start pulling out everything tipped in cotton or with a sharp edge. You're probably going to dig around in there and do more damage than good. All right, let's move on to cross-contamination prevention. Common sense stuff, a lot of this. Wash your hands before you handle it. No oral contact or exchanging of bodily fluids on, near, around the piercing for a minimum of 6 months. That doesn't mean you can't have sex for 6 months. That just means that you need some type of latex barrier between yourself and your partner. Now, understand, even after this piercing is healed, you are at a higher risk for STDs during intercourse. So if you switch partners, practice safe sex the way you're supposed to. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with this piercing needs to be cleaned on a regular basis. Do not swim. I know a lot of people are going to go and search out, and they're going to get a lot of different answers on this one. But here's the reality. During the healing process, that piercing is an open wound. This one heals very rapidly. I understand that. But at the same time, it is acceptable to infection. Now, If you get in a body of water that's large enough for you to move around in and submerge your whole body in, it's going to be filled with microorganisms. So you have a risk for getting an infection in the piercing. So if you don't want to get an infection, stay out of the water until it heals. Simple. Here's the one that everybody always gives me an odd look when I say it. Keep pets away from it. Keep pets away from it. Don't let them sleep in the bed with you. In fact, just limit their access to your bedding 100%. They can draw a lot of bacteria and other microorganisms into your bedding and then deposit it there, and then that gets into the wound and you have problems. Trauma, clothing, and abuse. Abuse. Avoid restrictive clothing. Anything that's like a stiff seam or a tight seam is not going to feel very good for a while. Or avoid clothing that may possibly get caught on the jewelry. If you have something that's kind of fancy, very lacy, etc., that kind of stuff sometimes can get caught on it, which can lead to issues. Don't sleep on the piercing. Make sure you're sleeping on your side or your back. Do not spin, rotate, or move the jewelry. Do not play with the jewelry. There's absolutely no reason to spin or rotate the jewelry. It's only going to prolong your healing and cause issues. Leave it alone. Avoid contact with the piercing as much as possible. Really, the only time you need to have any contact with that jewelry, in my opinion, is possibly when you're cleaning and then when you're checking the ends. It is a good idea to check the ends weekly. They can come unscrewed on their own, and it's my experience they usually fall off just as you sit down on the toilet. That's when you notice that it's loose, and you hear that clank in the bottom of the bowl. And once, I don't know about you, but once it's been in there, it's done. They ain't going back or near my body again. Risks. With this piercing, any piercing, there's always a risk of migration or rejection. If you have the correct anatomy and it's done correctly, that's very minimal. Of course, if you remove the jewelry for an extended period of time, it can close, though these are notorious for staying open for an extremely long time. Even with the jewelry out of them. They just are one of those piercings that stays open. The other risk, of course, as I mentioned already, is you're at a higher risk for STIs. Just do what you need to do. Practice safe sex like you're supposed to, and you should be fine. Now let's talk about the most common subject that comes up when it comes to piercings of genitalia. Sex. Gentle at first. If it feels uncomfortable or it's painful to get something done or you're having something done that does that, change positions, take a rest, try something else. It won't always feel that way, and it's kind of your body saying, hey, I don't like this abuse right now. Let me get more healed up here before we do this anymore. As I mentioned for the 15th time, latex barriers for a minimum of 6 months. Water-based lubricants only. Do not use anything that has spermicide, warming gels, lasts longer, or any of that chemical additive stuff. Just plain old water-based lubricant is your best option if you're using it. Now, if you use toys and you're adventurous in that way, I really suggest that you clean them on a regular basis. It is best, just out of precaution, put a condom on them, a new one every time. Especially if you've shared those with anybody else. Don't do that without a condom. Let's talk about anatomy, placement, and etc. Vulvas kind of come in two styles. There's hills and there's valleys. And everybody's kind of on that sliding scale between the two. Hills are going to be more outside the body, where it's more visible. Valley, it's more down inside. With this particular piercing, either should be fine. They both should work well. What we're concerned with anatomy is how large that clitoral hood is going to be, and if there's enough there to support the piercing safely. So it'd be done safely. The usual test with this is called a Q-tip test. Basically, we take a cotton tip applicator, usually remove a little bit of it, lube it up with some water-based lubricant, and then slide it under the hood to see how much of that area is going to be engulfed. We base whether or not we can do it on this because it'll generally tell us how much is there, where it's going to be placed, and if it's going to be safe. So if you're going in to get this done, it's always a good idea because it's such a piercing that you have to have the right anatomy for it, that you have a backup plan. If there's another piercing you're considering getting done, mention that if you can't work out this one. So you have a backup plan, so you still get pierced that day. Now, this is placed vertically. It actually goes through that very thin clitoral hood tissue, straight through, with the jewelry, the ball at the top, and then the jewelry being under the hood, and then a ball at the bottom. Curved barbells are what I suggest. I do not suggest straight or standard barbells. They should be internally threaded, meaning that the threading should have a ball that comes off of it that threads into the post, not the other way around. You can wear rings and circular jewelry in these once they heal. It's going to have a lot more contact with things. It's going to be more prone to getting caught, but it is possible. Some people like it a little bit more than they like the bars. So it's always a good idea with any of this stuff is experiment with different types of jewelry and see what works best for you. Now let's talk about pain in the piercing experience itself. Most people say on a scale of 1 to 10, this is between a 2 and a 5. With genital piercings, it's kind of an intense out. That hurts, and then it's over. Your endorphins kick in much more rapidly than they do on other piercings. I really highly suggest doing a breathing exercise where you take a deep breath through your nose, hold it, and then exhale through your mouth. If your piercer doesn't suggest this, ask them to do it. I don't suggest the 1, 2, 3, here we go kind of stuff. This is going to be a much better option because it kind of puts, it's kind of a form of meditation to get you in a more calm state and get through the piercing. Now, this is done freehand with a needle receiving tube. If you're unfamiliar with what a needle receiving tube is, it is a hollow tube, usually about 2 inches long. It is inserted underneath the clitoral hood and lined up with the mark, and then the needle is passed through into the tube. Sometimes it's not unusual to feel kind of a vibration or scraping sensation, and that's that needle going against that tube on the underside. And the tube's nice because that means we don't hit anything else. Once piercing is done, we take the jewelry with a guide pin, hook it into the back of the needle, push the needle out with it, take the guide pin off, put that ball on, and we are done. Not uncommon to have maybe a slight bit of tenderness to the touch on this one for a week or so, maybe some slight bleeding off and on for anywhere from 3 to 5 days. Varies from person to person. Now, one of the things I always suggest is, just to be on the safe side, is to wear a sanitary napkin or pad for that first 3 to 5 days. Not only is it going to cut down the likelihood of staining clothing, but it also adds a little bit more cushioning in the area and cuts down the amount of bacteria because it cuts down the amount of moisture. Things you should consider beforehand. First off, plan ahead. You're not going to be able to sleep on this piercing. It's best to have some, if you need like a body pillow or something to keep you from flipping over on your stomach, plan that all out ahead. Talk to your partner. I don't know how many people I've had that have come in to get this piercing or something else in that general area, or nipple piercings, and their whole point of getting it done is to surprise their significant other. Yes, they're going to be surprised, but also if it's a situation where it's a special event, they're also going to be kind of limited with what they get to do. So it's usually best to not do these things with those special events. It's also important to talk to your partner because this is going to affect their life for a short period of time, and it's a good idea to have their insight on this piercing. However, it is your body, it's your choice, but it's always best to communicate. The other thing is, I usually suggest to have a lot of fun time with your partner, maybe a day or so before, because things are going to be a little awkward and a little less than comfortable for a while. So get that kind of out of both of your systems. Loose-fitting clothing is best, especially the first couple days. Things like sweats and sweatpants and etc. Just something nice and comfortable. Also, if you can get this done a few days before you have a time off, or right before you have time off, so you have a few days to just kind of sit around the house and relax, not a bad idea either. You cannot swim. If you, in my opinion, I wouldn't suggest doing it for the first 3 months at all. So, if you're getting this done, you're an avid swimmer, plan ahead. Do it during a period of time when you're normally not in the water as much. If you're competitive, make sure it's at the end of that said thing. If you're doing triathlons, definitely you don't want this thing in lake water while it's healing. So, or ocean water, or river water, or any natural water. So plan ahead. Either give yourself plenty of time to heal this out before you're going to be back in the water, or do it after you're done with all that for the season and you have 3 to 4 months afterwards. Lastly, are you going on vacation? The problem with vacation is a couple of different things. First off, it's kind of a pain to deal with this thing while you're on vacation. I wouldn't want to deal with it personally. The other thing is that you're usually in an environment you've never been in before that has possibly microorganisms that you've never been exposed to before. So you're at a higher risk of contracting an infection and not having the immune system to fight it off. The other thing is you're probably going to want to swim, and I think we've talked enough on that for the day, that you shouldn't. All right, so if you have this piercing, please leave a comment. I'd love to hear your insight. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.